Both the Prime Minister and Ontario Premier Doug Ford, they're signaling the provinces and the feds may be getting close to a health funding agreement. It's been a months and months long stalemate, with Ottawa claiming to have billions on the table if provinces accept strings on the cash, and premiers opposing those strings, though that does appear to be shifting a bit now. This week, Nova Scotia's Tim Houston was on our program telling us he would accept federal conditions, and Ford said the same this week as well. We've got a very special edition of the Front Bench today to unpack all of that, taking you coast to coast to coast with former premiers. Joining us this evening, former British Columbia Premier Christy Clark, former Ontario Premier Kathleen Wynne, and former Nova Scotia Premier Darrell Dexter. Hi, everyone. Such a pleasure to welcome you to the show tonight. Thanks for making the time. Christy, I'll start with you. I feel like I have the same question for all three of you right off the bat. How much of this, watching this back and forth over the past number of months, has felt like deja vu?
Oh, deja vu all over and over and over and over again. It's exactly the same thing. I mean, part of the problem in Canada is that you've got two levels of government who are both responsible for healthcare, or responsible for funding healthcare. And you know how it works when more than one person is responsible. Nobody's responsible. Nobody's accountable. Everybody points fingers at the other people in the room, and they'll get to an agreement. I have no doubt about it. They'll decide to spend a bunch more money. There will be no way to keep track of it, as there ever is, so they can attach as many strings as they want. I mean, it's really kind of a hopeless, never-ending circle of the blame game, more money, no accountability, more blame, and the circle keeps going around and around.
Kathleen, do you have the sense that it's that futile as well? Was that your experience?
Well, that's depressing, Christy. That's depressing view. I think I'm going to be a bit more optimistic. I mean, I can remember a time when there were strings attached and there was money that went into the healthcare system, and there was transformation in terms of reducing wait times and so on in Ontario. I agree with Christy, though, that it looks like, and we know that the people of Canada want a deal. They want to see that the federal and the provincial governments are working together. I think that Prime Minister Trudeau has a real problem right now because there's not a lot of trust between the premiers and the federal government. Not everyone with everyone, but I think what Danielle Smith is doing in Alberta is very problematic. And so I would not be at all surprised, as has happened in the past, and Christy and Darrell know this well, that there would be some bilateral agreements to start out with. Maybe there'll be a unified front, but I would be very surprised if there weren't some initial agreements between the federal government and a province or a couple of provinces, and then you'll see everybody come on side. That's what I would predict would happen.
Well, Darrell, Kathleen kind of read my mind, because that's where I was going next, because that was the question essentially initially to Premier Ford today. Are you prepared, now that you've said you're willing to accept conditions, because not all the premiers have agreed to the same, are you prepared to do something bilateral? He kind of insisted he wasn't, but do you think that's the case? Do you think ultimately the feds will be able to pick apart provinces and go one-on-one?
Well, first, just let me say I feel a little different than Christy did, because I certainly felt accountable for healthcare when I was in the Premier's office. I think the bilateral question is, not one that should be pursued anxiously, at least by premiers. The reality of the situation is that the current policy of the federal government with respect to the Canada Health Transfer is the same as the Harper government before. They capped the rate of increase, which effectively meant a cut in healthcare funding, and that just continued. And so it's been that way for now more than a decade. And the healthcare funding could use a serious reset. And I think, through the kind of established program financing of healthcare is the best way to do that.
Christy, sort of back to the circular nature of it, though. Do you think there is a way around that? And if so, what would it be?
I mean, I know Darrell may have felt accountable, but I sure remember him pointing his finger at the feds like almost every other premier in the country has ever since the system began. I mean, I think it's a fundamental flaw in the system that you've got two levels of government responsible for funding it, and it really leaves a lot of room in between for the different levels to point at the other one to say, hey, you should be putting more money into this. And it goes both ways. And that argument has never gotten us anywhere. I don't know if this is a solvable problem. We might have solved it by now if it was. I do think, though, I mean, there is a more fundamental problem, Vassy, which is that we need to ask ourselves as Canadians. We have, in the developed world, the most expensive per capita health care, except for the United States. We also have some of the worst outcomes in the world, in the developed world, except for the United States. And I think if money was what we needed to solve the problem, we would have the best system in the world, but we don't. And I think we need to be thinking not just about the money, although that does matter. We really need to be focused between levels of government on real profound reform in our healthcare system to make it one that actually is affordable. And when we put more money in, it actually does mean that there's better service for Canadians. Because I don't think Canadians care where the money comes from. I don't care they care who's taking responsibility for it. I think what they care is that they get to the hospital, they get to emergency, they don't die waiting for care, that they can get their heart operation before it becomes, or their cancer care before it becomes too critical. That's what people care about. And just putting more money into a system that is so far from being reformed, and no one's even talking about reform, is not going to make it that much better. It's just going to keep us in the same old holding pattern.
Kathleen, it's interesting because that reminds me that, oh, sorry, Daryl, give me 1 second. I'll get to, or you go ahead actually quickly, and then I'll finish off with Kathleen.
Well, that's just where I do absolutely agree with Christy, and I think it doesn't matter whether you're a patient or a parent with a sick child or a healthcare worker; they're all exhausted by the status quo, and you know, this is an opportunity for the federal government to display some leadership when it comes to some kind of fundamental reforms, some new thinking about the way we deliver healthcare in Canada. And I would suggest that one of the things that the federal government could do is they could look at a national health human resource strategy, and with a number of components over which they could exercise a degree of control, or at the very least influence what the provinces are doing. And that would include, they could break down the barriers for healthcare workers from other countries to come into Canada. They could help smooth the accreditation process right across the country by working with provinces and working with the various colleges. They could focus some of their time and energy on what the training of healthcare workers looks like in this country. So there's lots that they could do if they truly wanted to change the way the system operates.
I just have a few seconds left in this round, Kathleen, but does that is that potentially exacerbating the issue that Christy mentioned, which is the two-pronged approach to healthcare, that those two levels of jurisdiction kind of can exacerbate the problem?
You know, Vassy, I really believe that people in Canada expect our publicly funded healthcare to be a national project. I think that I agree with Christy that the tension between the provincial and the federal governments isn't helpful. But what Daryl's talking about, and some kind of ongoing process that allows that ongoing review. The trouble is, what review means right now, if you listen to Danielle Smith and some of the other premiers, is a privatization of the system, which is not what Canadians want. And that, I think, is what's breaking down some of the trust. So I agree that there needs to be an ongoing discussion. There needs to be a process whereby there is ongoing transformation, but that has to be consistent with citizens' expectations of what the healthcare system will be. And I don't think that will happen province by province.